Dikecilkan. Nah, oke. Bu, Julan pakai ini enggak? Pakai itu aja, lanjut. Berarti ini tak matikan ya?
Oke, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, all of the students and also the lecturer from School of Nursing, all praises to Allah and salam, salawat to Prophet Muhammad sallallahu alaihi wasallam. Today it's a special day because we have a guest lecturer from Palestine, the nursing lecturer, Mr. Mohamed Zayed Al-Zatma, and he will present about the pediatric nursing in Palestine. So we have several events today. He will deliver for the presentation around 60 minutes, and then after that we can ask any question. So the students and also lecturer who have a question can raise your hand, or maybe I will use and I will have a time for you to ask, and we will give the time for the Mr. Zayed to answer the questions. We can continue our agenda for the presentation by Mr. Zayed. Okay, time is yours, Mr. Zayed.
Assalamu alaikum wa rahmatullahi wa barakatuh. بسم الله والصلاة والسلام على رسول الله. اللهم لا علم لنا إلا ما علمتنا. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا علما. Firstly, I want to send my sincere thanks and appreciation to everyone who contributed to my arrival in the state of Indonesia and the UMY, where I am now. From the Indonesia government, the UMY, and everyone who is responsible for the wonderful and distinguished facilities and arrangement to complete this training course, which will certainly add to all more experiences, information, and fantastic moments. And I hope that will be the beginning of the future partnership and cooperation that will open the field for exchanging experiences, inshallah. I want to introduce myself for you. I am Mohamed Zayed Al-Zatma, as Mr. Wallen said that before, from Palestine. About my work experiences, I am a lecturer in nursing science at many Palestinian universities, such as Al-Aqsa University, Al-Azhar University, Palestine College of Nursing. The second experience, I worked as a nursing clinical instructor at many universities, such as Arab College of Nursing, Palestine College of Nursing, and Al-Aqsa University, another. And I worked as a community health educator in YB, which is supervised by and funded by UNFPA. And before that, I worked as a nurse at many hot areas, such as emergency room, adult ICU, pediatric ICU, and cardiac surgery ICU. About my educations, I have maternal and child health nursing master degree from Al-Quds Abu Dis University in Palestine, and bachelor degree from Palestine in nursing from Palestine College of Nursing, which I am still working in it, and received many training courses at many different fields, especially nursing and English and other computer skills. To start our general lecture about pediatric and nursing pediatric or pediatric nursing in Palestine, we should make an introduction about nursing and pediatric of nursing. The nursing, as you know, is a diagnosis and treatment of human responses to actual and potential health problem. Actual and potential health problem. Its purpose to promote the highest possible state of health. To understand the expected findings, it's a normal range for population will assist the nurse to detect abnormal findings. Pediatric nursing is the art and science of giving nursing care to children from birth through adolescence, with emphasis the physical growth, mental, emotional, and psychosocial development.
Okay, there is maybe we will have Mr. Ziad for present about the PowerPoint, because in the Zoom it's disappear. Maybe Miss Dina, you can see the PowerPoint by Mr. Ziad?
Yes, I can see the PowerPoint.
Oh, you can.
Yes, I
see.
can.
Oh, okay. It's okay. Maybe about for mine. Okay, it's okay.
Okay, no problem. You can continue, please.
I will continue. The main aims of pediatric nurse are to prevent child disease and injury, assisting children, including those with permanent disability, achieve and maintain an optimum level of health and development, rehabilitating children whom have health deviations from the normal function. About demographic society of Palestine, if you know, Palestinian society has a high population growth rate and fertility rate, and the role of a student nurse will be as a health educator and health promoter by understanding and applying nursing process in the field of child nursing care, while stressing on holistic approach and family-centered care to achieve a high quality care. Palestinian population approximately 6 million people, 6 million persons, and they distributed to many places, as you know, in the demographic Palestine. They are approximately 2 million in Gaza Strip and 3 million in West Bank, and outside Palestine, approximately 4 millions. About the pyramids of population, as you know, the base of the pyramids is wide, but the top is narrow. This is the best indicator that Palestinian population is young age, from birth to maybe to adolescence. As you know, in left side of the pyramids, the population approximately 40 to 45% of Palestinian population will be below 20 years old, so that the pediatric of nursing, this is represent the pediatric and adolescents stage. It represents the pediatric and adolescent age, so that the pediatric nursing in Palestine is very important. To assess health of children within country, we should observe the rates of mortality and morbidity over the period of the time, so that the best indicator for community health will be represented by under 5 years old of the child health, so that this mortality and morbidity rate will give us information about causes of death, as well. I said that the next slide, and high risk age group for certain disorder and hazard, and advances in treatment and prevention and health counseling in Palestine. So that, what about health of Palestinian children? About the mortality rate or infant mortality rate, we are defined that as the number of deaths per 1,000 live birth during the first year of life in certain year. And this infant mortality rate will be divided to two groups. The first one, neonatal mortality rate at birth to 28 days, and postnatal mortality rate from 1 month to 12 months. As you see in this diagram, Palestinian mortality rate in 2018 was 11.7 per 1,000 live birth. This diagram from 1991 to 2018, we note that there is dramatic decrease from infant mortality rate, and this is have reasons for that. I will explain it later on. About neonatal mortality rate, it represents from birth to 28 days. It approximates 8.7% at 2014. Our Ministry of Health and the medical record will be not available to every years. This diagram will represent the years of that produced by Ministry of Health. About the decrease in infant mortality rate, that is before infectious disease control by pediatric vaccination coverage is 100% of pediatric. This is the cause of this highest coverage in the world. The Palestinian society depend on the donation from developed country about vaccination, so that it was free in our country. In nutritional advances, when we're talking about the Palestinian society, we are talking about developing country and poor society. But why the nutritional advances here? Because the Palestinian society and refugees depending on UNRWA of the nutritional donation, so that it's available and rich with the vitamins and minerals which need to promote children and pediatric in Palestine. The advert of antibiotic and antimicrobial agent, especially the previous outbreak of the corona or COVID-19. Recent improvement in perinatal care. The Palestinian women and Palestinian societies that give highest care for perinatal and pregnant women in our countries. About leading cause or causes of death, the mortality rate in Palestine, the first one is congenital malformation. Is the first cause of infant death in Palestine. Other one, pneumonia, prematurity and low birth weight, congenital heart disease, infectious disease, and other, as you see in this table, prematurity and low birth weight, congenital malformation, respiratory disorder in perinatal period. In the past, the first cause before this table date, the first cause of infant mortality rate was respiratory disorder. But now the first cause is congenital malformation. The second cause is prematurity and low birth weight. And the third cause the third cause is respiratory disorder. Under 5, mortality rate, which represent the best indicator for health of society. In Palestine, there is in addition dramatic decrease in the mortality rate. The same cause, the same reasons will explain this decrease or dramatic decrease in the mortality rate. About the causes at this age group from 1 to 5 years old, the accident is the first cause of this, and the second one, heart disease, this is the second cause, and we have many percent of cerebral palsy and transport accident, congenital malformation, malnutrition and metabolic disorder, infectious disease, and pneumonia, hepatic disorder, malignancy, and other. But the first one is causes the same cause is the same cause of the death at age group from 5 to 20 years old is accident in our countries. Now we are talking about the morbidity and the most common disease in Palestine. The morbidity, we are defined it as the prevalence of a specific illness in population at particular time by per 1,000 persons. A child morbidity, acute illness and symptoms severe enough to limit activity or require medical attention. It can be classified to acute illness such as respiratory disorder, infectious, and injuries. But the second group is a chronic disease or disabled. All of this group, it will limit the activity of the pediatric and the people in Palestine, so that we consider it like a morbidity. But we have now a new form of the diseases, such it includes behavioral, psychosocial, and educational problems such as poverty, violence, school failure. This is a new form of the morbidity in Palestine. We are talking about poverty. The newest percent of poor or poverty people in Palestine will be 80% of all people in Gaza Strip. It's the highest percent around the world. Injury related to morbidity, intentional, such as suicide, and unintentional, such as poisoning, falls, fire accidents, and etc. The first one of the most common pediatric disorder or disease in Palestine, neonatal conditions. We consider these conditions the high risk neonate, such as preterm infant or prematurity. Those infants who are born before 37 weeks of a pregnancy. Post-mature infant, or post-maturity, those infants who was born after 42 weeks of the pregnancy. Infant diabetic mother, and it's also a hypoglycemia followed the infant diabetic mother. Septicemia neonatal and jaundice or hyperbilirubinemia. This is a condition with neonatal or high risk neonate. We are considered that. And this is most common in Palestine, in neonate or pediatric disease in Palestine. In Palestine, from the moment of delivery, the immediate care of a newborn, the first one is dry the infant Why? Because the small amount, the small amount of newborn lose up to 200 calories per kg in minute. So that the first priority to care is dryness. Caring of umbilical cord, that cord is tied off approximately 2.5 centimeters from the abdominal wall by plastic clamp. And we should count the vessels because it's may be associated with cardiac or renal disease. And we make health education sessions for the family to how care the umbilical cord in the home if the baby is stable and go to the home. Caring of infant eye, 2 drops of silver nitrate to protect the neonate against gonorrheal conjunctivitis. After that, we administer the neonate 1 milligram of vitamin K IM in the delivery room to prevent hemorrhagic disorder because the liver of neonate are not is immature to manufacture the vitamin A normally. It check infant demographic or check the infant weight, height, and head circumference and chest circumference to follow up that after that. Apply ID band to infant arm and it to include mother name, hospital number, and infant sex and time to decrease any chance for any change to the child in the nursery. Record we record our observation about delivery and anesthesia, sedation, and sedation if use blood and any event occur during delivery process. About the respiratory system disorder in most common disease in Palestine at end of pediatric. The first cause no, I'm sorry for this interruption. Continue. About the respiratory system disorder for the most common disease in Palestine. The first one, respiratory distress syndrome or hyaline membrane disease due to the most common cause, prematurity and decreased amount of surfactant. And some of acute respiratory infections, such as tonsillitis, otitis media, pneumonia, croup, laryngotracheal bronchitis, epiglottitis, bronchial asthma, bronchiolitis is the most common disorder in neonate. Cystic fibrosis. Cystic fibrosis is considered exocrine gland, but the common insufficiency function associated with pulmonary insufficiency and pancreatic insufficiency is the causes of readmission or recurrent admission of the child in Palestine. During studying of students in the university and clinical training in hospital, we make the explanation of the most common disease and how to deal and science the definition of disease, most common microorganism of causes and pathophysiology and signs and symptoms and what is the medical management and the most appropriate medicine management for every disease that we'll see in the hospital and in the syllabus at the university. About the most common disease of GI system or gastrointestinal disorder, the acute infectious gastroenteritis And the signs and the complication of it, diarrhea and dehydration. Hypertrophic biliary stenosis, intussusception, cleft lip and cleft palate, esophageal atresia and esophageal fistula, Hirschsprung disease, aganglionic megacolon, and celiac disease. All of this disease is the most common cause of admission in the pediatric in the hospital and pediatric medical ward and pediatric ICU. About the cardiovascular disturbances, in Palestine, we have two types of disease. The first one is congenital heart defect, and second one, acquired heart defect. The congenital heart defect divided to many groups. A cyanotic heart defect and the other one cyanotic heart defect. The acyanotic heart defect, dextracardia. Well, when we are talking about dextracardia, most or usually associated with other disease, not only obstructive lesions such as aortic stenosis, pulmonary stenosis, coarctation of aorta, left to right shunt, conductus arteriosus, atrial septal defect, and ventricular septal defect. All of this is cyanotic forms of heart defect which are common in the cardiovascular disturbances. And cyanotic heart defect, teratology of Fallot, and this transposition of the great arteries, tricast atresia. The second one of cardiovascular disturbances is acquired cardiovascular disorder, such as bacterial or ineffective endocarditis, rheumatic fever, and congestive heart failure. Common pediatric disease in Palestine of hematologic disorder, sickle cell anemia, hemophilia, thalassemia, iron deficiency anemia, and idiopathic thrombocytopenic purpura, ITP. The most form of cancer or oncologic disorder is leukemia. About genitourinary condition, the most common forms is nephrotic syndrome and acute glomerulonephritis, UTI, urinary tract infection, congenital abnormalities such as cryptorchidism and hypospadias, urinary reflex, hydrocele. This is a form of congenital abnormalities usually associated with other disease. Metabolic and endocrine disturbances, we have two forms most common. The first one is congenital hypothyroidism, and second one is most common of endocrine and metabolic disturbances is juvenile diabetes mellitus, and it will be early diagnosed with admission due to DKA for undiagnosed child. Common pediatric disorder about neurological system or neurologic disorder. The first one is seizure disorder, epilepsy, and infectious, intracranial infectious, myelitis, encephalitis, and meningitis. Hydrocephalus, a neural tubal defect, encephaly, encephalocele, spina bifida. The most common type is spina bifida with three forms: spina bifida occulta, meningocele, and meningocele. About musculoskeletal, the DDH is the most common one of that, and deformity of the supine, scoliosis, kyphosis, lordosis, and rickets. Rickets is the most common, is common in a child due to decrease of milk and calcium, vitamin D. Sorry, child may or usually suffering from rickets. A child with special need, such as cerebral palsy and trisomy or Down syndrome, and they need to special nursing care, such as rehabilitation and educational therapy, and decrease or prevent infection, such as recurrent chest infection, which is the reasons of death in Palestine. And many situations of emergency, such as poisoning, and how to prevent injury, aspiration for an object, suffocation, parents drowning, bodily damage, motor vehicles injury. All of this form are the most common emergency situation which cause the increase the morbidity rate in Palestine. According to my experience, I think that nursing functions vary according to regional job structure, individual education, and experience, and personal career goals. Therefore, there is a difference in role, responsibilities, and work of pediatric nurse from other. The role of pediatric nurse involved in every aspect of a child growth and development, and ensuring that family are aware of all available health services, informed adequately of treatment and procedure involved in the child care when possible, and encouraged to change or support existing healthcare practices. To be a good nursing practice, or to be a good pediatric nurse, you must be good observer, sympathetic, kind patient, love to work with children, interested in family care, able to provide teaching to children and their family, has skills and qualified skills in providing treatment. As you know, the pediatric need the most accurate and the smallest amount of doses to prevent any toxicity level, as well as in a various nursing procedure, such as insertion, the IV line, and other. And you know, a child or pediatric or neonate have a small vein or a small IV line, so we need the qualified nurse to insert it. Organized in his work and follow the nursing process. In our teaching, we learn at this subject, we learn the all students to how be good pediatric, and we explain this and the recurrent explain this points to good deal with the pediatric patient. About the nursing process which we are follow in Palestine, the main aim of the nursing process, or the first priority, is open interactive therapeutic relationship between nurse and family of a client, not the client if the child cannot talk. It is essential for the delivery of nursing care through application nursing process as follows. The first step, as you know, assessment stage. When you be good assessment stage, we will complete the nursing process correct and ideal. The first point you should take in your mind, you should explain the nurse role and the purpose of interview to establish a clear nurse to child or parent relationship. And you should introduce yourself and explain the procedure before doing anything, and prepare yourself and your equipment to before going to the patient. Child and family members must be included to which encourage them to be cooperative with nurse. Assessing patient health status from head to toe assessment. The second one, nursing diagnosis stage, to identify the actual and potential problem which may facing the child and the family. As we define the nursing is dealing with actual and potential problem, so that the nursing diagnosis will be depending on actual and potential problem which may suffering or facing the children during receiving health care. And usually we learn and educate nursing student how to follow component of nursing diagnosis with this way. What's the meaning of this way? The first letter P, problem. You should explain the problem. The second one, E, etiology, the etiology of the disease. The last one, S, signs and symptoms of the disease. By following this way, you will have nursing diagnosis according to NANDA instruction. Planning stage, the third one. Our goal and expected goal or outcome. The goal, what is to be achieved by nursing intervention, and it's divided to long and short-term goal, and we learned that for the nursing student. The implementation stage. Implementation stage, when you want to put the plan into action, goal directed care. You should started to care to go ahead or toward the goal which you are established before. The nurse initiate and completes the intervention designed to help patient to achieve the goals and demonstrate the specified outcome criteria. The last stage is evaluation. The evaluation will be if the goal is met and make a comparison between the current status after the implementation stage with the admission or previous assessment or previous status. About the nursing care plan which our follow in Palestine or which learn to student to follow that during nursing care or to pediatric. Our nursing care plan it's contain identifying information about patient name, address, telephone number, sex, age, religion, referred from any hospital and the department, admission date, time, and informant, the person who tell us about the information of the child status, and chief complaint with medical diagnosis and the present illness. Then we learned that the student to take the general information about the current pulse, respiratory rate, blood pressure, length, head circumference, current weight, and if the patient have any past medical history, about the past medical history, nature of the pregnancy and type of pregnancy. This will explain if the child have recurrent admission due to past medical history, and if the child received the immunization. And in Palestine, we have a program for immunization from the birth to 6 years, and other to female they received at 12 years old. Previous hospitalization of the child have recurrent admission to hospital, and when and why, operation and injury. Allergies, if the child have allergy, major illness, acute infectious disease, and current medication. And family history of the disease is chronic, if the family history about the disease. History of a chronic disease, hereditary disease, age, nature of death, if the family have one missed or more. And then we learn student how to make assessment from head to toe, and good assessment will lead to good correct diagnosis, and correct diagnosis will be good planning, and good planning will be good intervention to best outcome. We will evaluate and assess the skin about any rash, pigmented or itching, sweating, color, wound, or other, so that these symptoms may be associated with other disease, and the student, when he know about this disease, his concentration and might lead to some specific disease associated with these symptoms. Skeletal system about stiffness joint, pain, deformity, resistance of motion, swelling, redness, heat, and other. If the student have any comment about this. Head, if the child have headache, dizziness, syncope, injury, and other. Each symptoms will be a child alert about the disease, such as before a stiffness of neck stiffness. It may be associated with meningitis or encephalitis. The concentration of the student will lead toward this disease. Eyes. If the child have impaired vision, pain, photophobia, usually associated with encephalitis or meningitis, we learn that to every student. Redness, itching, burning, discharge, yellowish, glasses, infection, and other. And nose for any colds, obstruction, epistaxis, ear about the hearing, acuity, earache, and discharge, tinnitus, vertigo, and other. About teeth, pain, bleeding, swollen, gum and extraction, abscess, dental hygiene, how, mouth and tongue, soreness, swelling, ulcer, and other. Throat, sore throat, tonsillitis, hoarseness, dysphagia, and other. Neck, if the child have pain, stiffness, swelling, enlarged gland, and enlarged lymph node. Anyone found or patient have this, anyone, that the nurse should, the student nurse or nurse should be the signs on these symptoms. About endocrine system, the student nurse and the nurse should be good assessment about any goiter, thyroid, tenderness, hormonal therapy, weakness, tremors, and intolerance to heat. All of these the symptoms may be associated with disease of endocrine system. About respiratory system, chest pain, dyspnea, wheezing, cough, sputum, hemoptysis, and other. Cardiac, chest pain, palpitation, dyspnea, orthopnea, edema, cyanosis, exercises intolerance, and other may indicators for the cardiac problem. Hematologic, anemia, tendency to bleed, thrombosis, or any other. Lymph node, if enlargement, tenderness, abrasions, and other. Gastrointestinal system, if patient have anorexia, nausea, vomiting, hematoemesis, diarrhea, constipation, abnormal stool color, and any one. Genitourinary, if dysuria or urgency, frequency, hematuria, nocturia, polyuria, anyone. Neuromuscular, about the oriented to time, place, person, etc. Altered memory, cognition, twitching, weakness, paralysis, and any one of them. General constitutional symptoms, fever, chills, and malaise, fatigability, recent weight loss, and anyone. And after that, the nursing student should follow this personal and psychosocial history. and family assessment to be involved in healthcare. In nutritional assessment about any allergy or usual meal and other. As I said before, the rickets is associated with malnourished food with rich with vitamin D. So that good nutritional assessment will detect the reason of this disease. And after that, updated lab investigation test and any medical procedure to diagnose, followed by nursing diagnose on by following this way, the problem and etiology and signs and symptoms of the problem. That's about the the pediatric nursing care plan. We have another form for neonatal nursing care plan with some specificity for neonatal age, such as date of delivery, delivery time, and if the admission data, such as time of admission, placed in warmer or not, eye prophylaxis, silver, and vitamin K if received or not, and umbilical cord care, and the blood type and RH factor. The other assessment and elements, the same with pediatric. The last thing I want to explain it, the method of nursing or nursing documentation for nursing note. We follow the narrative charting to make a nursing student have a good assessment to write the ideal nursing note by followed this element of narrative charting. The first one, the nursing student and the nurse should assess the level of consciousness. If the child conscious, unconscious, semi-conscious, each one indicate to some disease. And about awareness or orientation, if the child or the person or patient oriented to X3. X3 means time, place, and person. If oriented to all of them or semi-oriented by missing anyone. Skin color, about the normal is pink skin color. If the pale skin color found, we will make an question mark about the cause, and the good assessment will lead to go to good lab investigation and good diagnosis and good in the management. If the cyanosis occur or other. AM care if done or not, about vital signs, temperature, pulse, blood pressure, respiratory rate, and dependency level if patient dependent on himself or independent on himself or dependent on other. Motor and activity if ambulate, bedridden, active or inactive. After that, we will, with the nursing student, ask about the main complaint if the person or patient complain from anything. Then we will ask about the IV cannula and the fluid and short description about type of fluid, pediatric saline, normal saline, ringer, and that's it. Wound and dressing and short specific description about this, lines and the tube, feeding appetite, elimination, and other nursing action if it's done. Now we have a example about the nursing note for some student written by them. If they follow this narrative, charting will have a ideal or the best nursing note and good assessment for patient condition.
Unmute. Okay. Okay. Thank you so much for Mr. Zed for the enlightening lecture for us. And today we have many participants here. Have asked any questions? Okay, for the participants, you can ask the question for Mr. Zed. Please, you can raise your hand. I think there are many common problems in Palestinians in Indonesia, right? And you said many common diseases in there for the neonatal and also for the pediatric. And for the, I just want to know about the vaccination. You said that the pediatric vaccination coverage, 100%. So maybe you can tell with us about what kind of the immunization. You said that from the birth until 12 years, right?
Yeah.
Yes. Maybe you can explain more.
Thank you, Mr. William, about your question about immunization type. Immunization type in Palestine. Immunization program at birth should be BCG, the first one, BCG during the first week, BCG and hepatitis B. And the second one, it will be at 2 months about the OBV and IBV, penta vaccination, and BCV and rotavirus vaccine. And for another one, it will be at 4th month, then 6 months, then 9 months, then 1 year, and 18 months. Yeah. I think it's the same in your country.
Yes. Okay. And maybe in Indonesia we have a PSIK for the pneumonia.
Pneumococcal vaccine.
Yeah. Also in there you have immunization is for the basic immunization or for additional.
Again.
For the PCV, it's a basic immunization. I mean that, that's coverage for 100 children get it or only additional.
It's firstly pediatric receive this vaccination, and anyone, everyone followed this program.
Oh, okay. Maybe for the audience, you have a question for Mr. Zed, please.
Miss Fulan, there is Bu Ifa.
Miss Dina.
Bu Ifa raise her hand.
Okay, yeah, Bu Ifa. Okay, Miss Ifa, you can ask your question for Mr. Zed.
Okay, thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
No voice.
No voice?
Apa? Suaranya dengung soalnya. Dari kami, saya dengarnya dengung.
Okay, Miss Ifa, please.
I want to ask you a question, Mr. Ziad. As we know, in Palestine there was a conflict between Palestine and Israel, and I think there is maybe trauma for the children in near the conflict area, and how the nurses do their role as nurse to minimize the trauma for the children in the conflict area. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you for your questions. About nursing in Palestine, nurses in Palestine, usually we have an emergency plan for any war or any conflict events, so that many disabled pediatric, many disabled adult, and in the war, it's a really difficult time for providing care for the injured and disabled person. Many of pediatric and many of people in Palestine did from a huge amount of injuries. So that they are not received the care, the best care for and treatment for survival. So we have many problems about this situation.
Okay, Ms. Eva, it's clear?
So you mean there are many aids in Palestine that will help the children in the conflict area, to help the children there pass through the conflict, to pass the conflict, so they will have what kind of good or positive side in life. Do you think that was I get from you?
Okay, Ms. Eva, you can maybe just a briefly question, and Mr. Zayat needs more explanation, or maybe about the brief question for you. You said that in the conflict area have nurses to give a positive insight.
Yeah.
Okay, because
on the war or any conflict events, the role of nurses just in hospital, because everyone can move on the ground, maybe did by the Israel soldier. So that the nursing role just in hospital.
Okay, thank you. Thank you very much.
You are welcome.
yeah.
About strategies to deal with premature and neonate strategies, it's applied in medical protocols which established by medical team. In Palestine, we have a high risk for prematurity and low birth weight, so that our intervention is limited by the protocol, by followed medical protocols which established by the doctors.
Okay, Ms. Verika, he answered your question, or maybe you need more explanation about the innovation strategies for combat the premature birth. Yes.
To prevent the occurrence, low birth weight or other primary health care in Palestine follow the program to about measurement for pregnancy and ultrasound for the fetus. If any problem or any changes, we will classified this mother for high risk pregnancy and high risk for deliver premature or preterm infant, and the admission will be done early for at seventh month of the pregnancy. After delivery, if a child is premature or low birth weight, the doctor will make admission for this fetus or this for this pediatric for this newborn to the SCIBU, Special Care Baby Unit, which is specialist to deal with premature and preterm by followed the if needed blood transfusion or antibiotic or nutritional materials such as total parenteral nutrition and a specific formula of milk. And it's the usual intervention according to the age of birth. I hope the explanation is clear for your question.
Ms. Verika, is it clear? Thank you. Okay, the other question for Ms. Dina. Yes. Assalamualaikum. I have a question in your PowerPoint. You showed that the congenital malformation have high grade in Palestine. Could you please explain why it can be high grade, the congenital?
About congenital malformation, there is many risk factor, not causes, but risk factor. The risk factor may be associated with the pregnancy period or pre-pregnancy or at delivery cause. May be associated with malnutrition or mother and father is relative to each other with high risk malformation, congenital malformation, and maybe to exposure to teratogenic agent and exposure to X-ray and radiated agent and chemical substance, and maybe by affected by the war, by Israeli occupation, by weapon, phosphoric weapon, and other of that.
Okay, thank you for the answer. And I still interesting about how the relationship is it in the Palestine still have the relationship between father and mother, which contribute to the congenital malformation. Okay.
Yes, that's right. It will be high risk for many diseases such as metabolic disorder and Down syndrome and many of the diseases, diabetic, hypertension, and congenital cardiac disturbances, and such as.
How about the family relationship and the family relationship between father and mother, which contribute to the disease?
It's will be different from disease to another. Some diseases have high percent or high risk factor about us, and when talk about risk factor, it will be contributed disease may occur and may not.
Okay, I got it. Thank you.
Thank you. You are welcome.
Is there any question from the participants? You can write down in the text box, or maybe you can raise your hand. We have still we have the time. I think it's a really interesting about the nursing care plan for the pediatric and neonatal. We have maybe a similar form, and in the PowerPoint you write down the pediatric for the state of Palestine, Palestine College of Nursing, right? So nursing students learn how to fill in, and then it applied to the teaching hospital. And the hospital use the similar or same. Oh.
I am a student of Palestinian College of Nursing, and I am employed in it now.
Okay. So it's the same. Kupikir ini bisa di print out.
Every day at three times in the day, in the morning and in the evening at night. 8 p.m., 3 p.m., 8 a.m., 3 p.m., and 10 p.m.
Okay, yeah, I think it's clear, yeah? Is there any question or it's enough for today? I think it's a really enlightening lecture from Mr. Zia about the pediatric nursing in Palestine, and we get more insight about it. And thank you so much for the participants who has a question and Mr. Zia answer. I think it's for me, I get more information, and thank you so much for Mr. Zia for sharing your experience for us. And as a moderator today, my name is Walana Kiani. I'm so sorry to have many mistakes or maybe a technical problem here. I hope you enjoyed with the general lecture and we get more information about the information from the Mr. Zia about the Palestinian nursing pediatric. Okay, I think thank you so much for you coming here. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Finally, I want to thank you about this opportunity and this chance. I am very happy to be among with you here in country of Indonesia, which is characterized by a beautiful weather, with a wonderful nature view, fantastic food, and beautiful, kind people with Islamic morals. Really, I really like what I saw here, and I will work to conveying culture and wonderful experiences to my country in Palestine. Thank you very much about everything.
Welcome. Yeah. Okay, bye-bye.